Hello, everyone. Welcome, welcome. This is Erica Carbajal with the Becker's Healthcare team. Thank you so much for joining us for today's webinar, From Turnover to Transformation, the Strategic Value of Interim Leadership. Before we get started here, I've got just a few housekeeping notes on the back end to go through. So if you have any questions for our speakers throughout the webinar, please do send those questions into the Q&A box that you should see on your screen, and we will follow up to get you an answer if in the event we don't get to your question. Today's session is also being recorded, so it will be available for you all to reference back to after the event. You can go ahead and use the same login information you used to log into today's webinar to access that recording once it's available. And if at any time you're having any issues with audio, visuals, just try refreshing your browser. You can also submit any technical questions into that Q&A box. We're here to help on the back end with those. With that, I'm pleased to introduce today's speakers. First, we're joined by Sheri Lamoureux, Vice President of Human Services and Chief Human Resources Officer at United Health Services, Samantha Hanson, Interim Executive Vice President and Chief Administrative Officer at WellSpan Health, River Meisinger, Regional Vice President of Business Development at AMN Healthcare, Ben Harber, Vice President of Interim Solutions at AMN, Preston Rasmussen, Division Vice President of Client Sales at AMN Healthcare. Thank you all so much for being here today. Excited for this conversation. Well, with that, let's start with a lay of the land of the industry. Can you start by sharing a little bit about the current state of the leadership workforce in healthcare? What are you all seeing today at AMN Healthcare, the partners you work with?
Erica, thank you. I'll get us started here. And what a great question. I think as we look at the current industry, the current trends of where we stand overall in healthcare, one word, right? Opportunistic. If you want to think forward, right, around potential challenges, right, or where are we headed? So a lot of thought here, right, coming out of maybe what we want to call post-pandemic or COVID era. I think a lot of systems, right, we have the honor to get to work across systems and landscapes in all shapes and sizes, have gone through an immense challenge, right, around when we look at staffing shortages and opportunistic, the ability to decrease contract labor. We've seen a lot of that, right, on the nurse and allied side. And, you know, as we look into the next decade of healthcare, looking at the provider setting has also started to become so crucial, right? So as we look at the providers, the provider pipeline of where does that lead us into the future, those are just two of the themes we are seeing today. Over the last year, I think, you know, another huge theme we've seen, right, is the focus, the importance of how is AI going to match, going to meet and be a part of our industry in helping to not only create access, right, but to continue to lift, right, in a world where today in healthcare, we have more to do with not enough. A lot of times, right? So the ability to increase access through AI is another one. And, you know, then maybe looking at one of the components, right? Cost, right? Cost of care. We think of reimbursements. We think of operational costs. How is that impacting? And those two curves are challenging. I think dependent on system, dependent on makeup of system, I think everybody can resiliently say that is on top of mind or within top of mind of discussions. And so centering to your question on how does leadership focus on this, there's no more important topic today than getting leadership correct, making sure that we've got the right teams in place. And one thing we've seen here over the last, let's say 12 to 18 months, maybe even 24 months is retirements, right? So if we look at 2025 Q1 alone, 45 plus exits in CEOs, right? If we were to look in Q2, Q3, what we can see is the forecasted change at a system leadership level in amounts and in changes that we haven't seen at this level in quite a long time, right? So the focus of system executive transitions is a massive focus right now. And so when we think of the downstream impact of the current state of the workforce, no more important topic than how do you plan, right? How does Interim become a part of being engaged in resiliency and making sure that as we think of the topics we've covered in the pain points of where are we leading forward, making sure you've got the right leaders in place to continue to drive the strategy and the mission in the organizations that we get to be a part of. So painting a bit of the picture, that would be the beginning of where I would start there. Erica?
River, I would just write those, just make a quick comment in regard to not only retirements, but we're talking, when I'm out visiting with our leaders in the markets at the various health systems, we're seeing that burnout is certainly forefront of mind as well. And so I wanted to sort of call out that, yes, we're seeing the need for retirements. Obviously that markets and landscape is shifting, but we're also seeing high burnout rates, talking about existing leaders being stretched really thin in their current roles, wearing multiple hats. And so really, the premise of this webinar is really to dive into calming that chaos. How do we prepare for it? How do we help our systems and partners that are on this call, and maybe those that will listen in later? How do we really help stabilize that industry?
And just from some calls this morning, but pretty normal for the times that we live in, as reference, our leaders are in hospitals and systems across the country. And what I hear the most of is the importance of the prioritization. Our evolving environment has so many things, and our leaders are at the table, and it's really deciding across these priorities what needs to be done and what can wait, and what order of those top priorities to be done. So that importance of getting the right leaders at the table to help navigate the retirements, the burnout, and just making sure that the systems and our partners are best optimized to take on the environment is really paramount right now.
Yeah, thank you all. I think helpful remarks to really give a sense of what's driving the shift in elevating the role of interim leaders. From your experience, what are some of the most pressing challenges that healthcare organizations are facing when there is a leadership transition at the C-suite level?
I'll jump in here, and happy Hospitals Week to those that are celebrating this week as well. I know many of our HR folks are all over the place this week, enjoying the helping our folks and celebrating. When it comes from a challenges perspective, Erica, healthcare leadership teams are under immense pressure, balancing organizational continuity and cost containment, when these situations arise. And when they do arise, the first priority really is to do a quick assessment of the situation to determine what are the needs of the organization, what is the organization that this person is potentially vacating, what's the current state of it, and to really make an assessment of what's needed immediately as well as what's needed in the future. In addition, you also think about things like, is the team aligned? Are there internal candidates potentially ready to step up to be able to take on this role, or do they need sort of development? And we've seen, in my experience, utilizing interim leadership has really elevated a team in a very short period of time. One of the other elements that we look at are the financial constraints. When you bring in somebody for a short period of time, there obviously are financial considerations along with this. And so what are those financial considerations in considering whether you bring in somebody on an interim basis, whether you split the responsibilities, whether you promote from within, or whether you, like I said, you engage this interim leadership, but really being very thoughtful and strategic about how you go about filling this position. But honestly, utilizing interim leaders, and we've utilized them here in my organization, and to very great ability, they really have done a fabulous job when we've asked them to come in and to help our organization in different situations.
And if I could jump in and piggyback, one of the other key aspects when you have leadership transition is evaluating the cost of delay. So you have a transition period with an executive that's, winding down their time. And then also the period in which finding either an internal or an external candidate who is then ramped up. So I would invite organizations to consider the value of interim executives as coming in and helping to close that gap of any cost of delay. Interim executive leadership can come in and be just in time, keep key, transformative, and other initiatives running, while the organization can then have the time to fully vet and assess the appropriate long-term candidate for the role.
Maybe to build on that just a little bit, Sam, to your point there is not only just cost of delay, but I think in today's environment, thinking of some specific examples recently, the importance, right, of evaluating succession planning, right? So specifically from the clinical lens, I can think of two most recent examples where, we have either really incredible clinicians, both from a provider landscape of a physician and or nurses, right? But we haven't built a bench, right? So not only an evaluation to say, how to make that decision immediately, but then also from a lens, can we build on that, right, within leaders to make sure that we build planning to actually have succession planning that goes on concurrently during those decisions. And going back maybe to that talent gap and talent pipeline, making sure we're addressing and helping to build there as well.
Not an uncommon situation. It's actually becoming more prevalent in recent times. But when our interim leaders, our clients are looking at our interim leaders, often I'm hearing about projects or initiatives that are pushed past this year, maybe even 27, that I hear leadership teams discussing, well, if we could get this interim leader to come in here for X amount of time, we could pull something out of Q4 26 plan into this second half of 25. And what would that do for us? And our marketplaces have never been more competitive for our clients. And every bit of that kind of help really changes their game.
Agreed. The speed of transformation is accelerating rapidly, as exemplified by our use of technology, including AI, as River mentioned earlier. And you really can't afford to spend 6 months or longer in a state of evaluation or pause for that transition. And interim executive leadership can ensure that your organization can continue on in a healthy and competitive pace.
Yeah, it really sounds like it's a way to move quickly, but also effectively. Preston, was there anything else you wanted to add on this point?
No, I think the group did a really good job on talking about the topics that they really hit on. I think that succession planning, obviously huge, project driven. A lot of people think interim leaders need to come in and fill a specific gap, but they don't think about that in running in tandem with a certain project that needs to be rolled out. To the group's point, having their own internal leader running the day-to-day while the interim comes in and runs the project, or vice versa, really being able to fine-tune what that leader can help lift, as opposed to just taking on all the things, right? I think that's really the point. I think the group did a good job in sort of calling out here.
Something we've heard the sentiment too of like, what can we help immediately with? What can we start acting on as quickly as possible? I want to turn now to some specifics. So we started with really setting the stage, now really getting into that calming the chaos. If you could share a time when an interim leader stepped into a chaotic situation and successfully stabilized the organization, what key actions made the difference in those situations?
I can jump in here. We had an example of, actually, we were in the process of implementing Epic here within our organization, and had exit of our person overseeing our information technology area. And we went through a process of identifying a replacement CIO on an interim basis to step into this situation. That came to working with an organization. And also as part of that, we identified a number of resumes, we interviewed candidates, but it was a tremendous destabilizing time potentially for the organization with this massive implementation of a health records system. And so by bringing an interim candidate in, they had a proven track record, frankly, of implementing Epic in other organizations. They did a tremendous job of really upskilling the department along with implementing Epic. It helped to maintain continuity, frankly, from where we were to where we wanted to go, and also preserving trust with this transition as well within the team, as well as sustaining the culture. So this was just one example. We've had several examples in the organization, which I'll allude to probably a little bit later on as well. But this was a very challenging time for the organization. This person stepped in very, very easily, helped and worked very well with the team to move us in the right direction to implement it very flawlessly, frankly.
I'll jump in here. The role that I just wrapped up at WellSpan, the purpose of interim leadership for them was not about chaos, but was more about exploration and acceleration of outcomes. Specifically, the very visionary CEO wanted to create a new org structure at the senior level and wanted to see if a chief administrative officer role would help accelerate the performance of legal, IT, innovation, and HR, specifically as those organizations were critical to supporting some large transformational growth initiatives. And so when I came in there, it was about evaluating what was possible with the CAO role, helping to shape, structure, and demonstrate the efficacy of the CAO organization. And in the course of just 6 months, not only demonstrating that that role was important for the health system, but was a vital accelerator for what will be some pretty transformational work that's coming in the months and years ahead. So you can have a resolution of chaos, but it also can be a way to explore and initiate new leadership capabilities for an organization.
Love Sheri and Sam, so dead on. And you know what I would add too, just as something to think as a paradigm, our interim leaders, when they come on assignment, we're all busy with our day-to-day in all of our leadership roles, and we carry that work with us, and it kind of builds volume and weight to it. When an interim leader comes in, generally when they're onboarded, they're giving a handful of key priorities, top tasks to perform and accomplishments, so they're lasered and they're focused. And after 6 months or 5 months, you're going to see because they don't have all that residual that they're carrying, and they're really a specialist, lasered for performance and results. And just like Sam and Sheri said, speed comes along with it very, very easily.
Yeah. I love the idea of interim as being more than just keeping the train on the tracks, if you will. Interim executives have proven expertise. They have the ability to assess and make best practice recommendation and then implement solutions and then provide a fast start for that permanent candidate. So envision a person that's in there and then is building that 30, 60, 90-day plan to hand to your permanent executive. And it actually becomes an accelerator for their performance as well.
Right. And if I can just add into there, we've had experience as well as not only, bringing somebody as an interim, but then they actually will end up staying with the organization as well. So it's almost like a try before you buy opportunity because you've had an opportunity to kind of explore. They've had an opportunity to get to know the culture, to see if this is a good fit for them as well. And we've had some very successful interim leaders that actually end up staying with the organization as well.
I'll just make one more comment on Sam's point because she keeps making some great ones, and Sheri too. But we all have in the permanent world, we have people come and go, and people roll off, and hopefully everyone does a good job of handing off to the next person coming in. In the permanent world, we don't always have a lot of that rollover or that overlap. it's central in our roles. Sam, you mentioned your role off at WellSpan. Our interim leaders know a big part of their job is not just installing the improvements and bringing things to high performance, but it's also onboarding who replaces them. And so I think that's a benefit that's so important that Sam pointed out.
I would just echo too, Sam, that I know we're talking about interims at the executive level. However, a lot of that chaos comes from the director, manager, supervisor type roles, right, where there is a little bit of chaos, maybe some unannounced exits from an organization, and so there, right to the chief nursing officer, there may be some nerves around that. I think that our team does such a great job in being able to allow the organization time to be able to make a thoughtful decision on their next hire, while I think you mentioned it, keeping the train on the tracks, but also instilling sort of the cultural piece to that there is somebody at the helm, there's somebody in charge, there's a little bit of that calming, so that an organization doesn't feel like they've got to hire, the first three people, or the first three resumes that come across their desk. It allows them time to be able to make the right decision. And in some cases, as it was just called out, maybe you've got a really great interim leader that you could convince to stay, right? That's Sheri, I think you mentioned it, try before you buy. What a success story for everyone.
Yeah, thank you all. This is interesting to hear really the value that interim leaders can bring in seeing what's possible organizationally, as you all mentioned, and also being able to identify someone who has those specific skills and a proven track record to drive improvements in the specific areas that the organization needs. And yeah, Sheri, to your point, I know we had done some coverage late last year just on that trend of increasingly interim leaders taking on more permanent roles in the last year and a half or so. We've chatted about the critical role that interim leaders can really play in bringing some stabilization. But beyond that, if we could chat briefly about the role in creating lasting change. Ben and River, how do interim executives go beyond simply filling a gap and instead actually drive meaningful long-term transformation from your perspectives?
I can kick us off here. I think Sam just stated how it's happening at WellSpan, right? So, I think meaningful long-term change in an organization means, first and foremost, surmised really well by the group before. I think one of the ultimate compliments for any interim leader we have in place is being asked to stay. And so there is that factor and component, right? When we have matched cultural values well, when we have set expectations early of project and sustainability, it is more than often, right, that we see our interims or the interim on assignment be invited to continue to be a part of the system. And so that meaningful change, right, lives on through the transition, whether they stay or not, and the effect and impact that they've made. The other one that, I'll call out, right, just thinking of a specific example, right, I think of a partner we use and work closely with in Atlanta, in the Georgia market. And, I think the other complement, right, of sustainable change is remembering a name, right? I can think of an interim that was, helping to lead a very large quality team in a very large hospital, right? And so to this day, it's not just the leader who is working with that individual, it's the team members in the departments, right? They still remember that individual. They go back to them, right, and think through that and what is the effects, the impacts that they make. And then ultimately, right, if we kind of circle back to the meaningful change beyond, right, those two things, it's seeing leaders grow, right? So I think most intentionally, as we start to look at succession planning, as we look at good design of teams or, projects, a lot of times, right, being able to build that bench, help to build that bench and facilitate the growth. I think we'll see that more and more in systems going forward, is that intentional succession planning and building of team members to make sure that the residual change stays well beyond the task and assignment. It's really building the future of where they're going as a leadership team and as a system.
Well said, River. We take a lot of pride in our our candidate database. We have, with all these decades, we have certainly a talent for every role out there, but we take most pride in making sure we find the best fit for every role. And our interim leaders are very much attuned to making transformational change that lasts. They've been in these roles full time. Sometimes 10, 15 years with a prior organization. So they're not looking at anything that's a Band-Aid, a fix, something that will last a little bit. They're looking at how to fix root causes and how to make them last. You know, to the point on the attractiveness of these roles turning permanent, you know, I'm so proud every time I receive a notice from a client that they're interested in doing so. And I'll share, you know, that's between 20 and it's between a fifth and a fourth of all of our assignments. We have some type of interest in, would this candidate be interested in staying with us full term, on a permanent basis? It is across the whole group. It's single digits when that actually happens on a percentage basis. And it doesn't mean that some of our clients don't have a higher percentage of that than others. But back to the interim leader, by their DNA, they're problem solvers. They're wanting to respond, create plans, create improvements, and they're I wouldn't call them adrenaline junkies, but they're interested in that part of it. And so it takes a heck of a situation or offer for them to consider coming out of that, because they're just at the stage of their career or their interest level is really that type of work at that point.
I'd like to just add too, from my chair, I know that in sitting with clients, you know, much like Sheri and Sam, as we're discussing the need right out the gate, we're engaging in what, you know, an intake questionnaire to really understand maybe what the need is, why the need exists. Is it, you know, to replace somebody who left, you know, on maybe unfavorable terms, or is this succession planning? So we really, every role is different, every opportunity is different, every interim leader is different. And so when, to Ben's point, I think when we do get it right, it's, you know, it's a really exciting thing for us here at AMN that we're able to get it right. I just also want to add too that, you know, this also benefits our rural communities in the fact that, you know, from a rural community standpoint, recruiting is hard. You know, I remember being in parts of Minnesota that were very cold and hard to recruit for, but you get somebody out there on an interim basis and they fall in love with the ice fishing or, you know, the cold temperatures, they figure that they can make it. You know, again, it's where we go to win. And I think that's, you know, on the onset of any specific need, it's really identifying, you know, those key elements early on in the process.
Yeah, certainly. Thank you all. I want to chat about financial recovery for a beat here. Many health systems, as you all know, facing financial strain. About 40% of hospitals still losing money. How can an interim leader help a hospital or health system get back to black and ensure that financial sustainability is on the horizon?
I actually have a story about this. Prior to COVID, and actually when COVID started happening, we had a situation where we had a vacancy in our chief financial officer area, and the organization, as COVID started to really obviously continue, we had some intense financial pressure on our organization to reduce our costs quickly and responsibly. And so we brought an interim CFO in with the mandate to identify some cost savings in the organization, opportunities to really enhance our financial operations and to restore some fiscal discipline. That interim, we interviewed a number of people, honestly, for this role. The industry experience really mattered quite a bit for us. And also, when we looked at who we are identifying as a candidate for our organization, looking at whether they had for-profit or nonprofit experience was also something that we considered as well, given the situation, and what would translate with our organization, how to effectively move our organization in the direction we needed to go into. In addition, you know, in looking at this, we looked at the cost of having the vacancy versus not, you know, and filling it maybe with somebody that's new to the role, be a major promotion and difficult to fill position, and whether that person was ready to take on this role. But even, you know, a short leadership gap in the CFO position was a problem in this time period, especially obviously during the pandemic, and whether that would impact greater inefficiencies and strategic drift, given where we were during this time period. So for us, in looking at interim leader, we really could not afford not to have somebody in this role during this time period, and it was directionally, obviously, really directly tied to revenue and cost containment for us, and that's just one example of really successful interim leader that we brought into the organization that really helped us during this time period.
I'll jump in on Sheri's wonderful example, and I think that that's fairly a common opportunity for clients considering interim leadership. As I had mentioned before, the cost of delay is counterbalanced with the speed of completion. So if you think about key transformation efforts and strategic efforts that all of our health systems are undertaking right now, the cost of delay while we're waiting for a permanent executive to come in can be a derailer down the road, particularly for those health systems that are in a highly competitive market. So envision the ability to accelerate your transformation and keeping those projects on time, even ahead of time. The other opportunity for consideration in interim leadership is the capacity that an interim leader can bring. Thinking about a just-in-time executive leader that's brought in to help build capacity so that your executive leaders, who all of whom, as we talked about burnout earlier in the webinar, have more than enough on their plate. And yet we are redefining our revenue models, our expansion models, partnership models, et cetera. And those take attention units from our key leaders and our executive teams. Now imagine an interim executive leader coming in and helping and be that capacity builder, that expander for your team that is time limited and able to help you and your organization accomplish your transformative ideas while not further burdening already at capacity executives. So that helps with retention on that part as well.
I would add, just in terms of leaders that we have out on assignment right now, I can think of some that are doing amazing work with revenue cycle, really bringing up yield and helping directly feed bottom line. I can think of supply chain folks as well, doing some masterful things for our clients. But I also think of just really every role that I'm involved with discovery calls on, OR directors who are helping improve efficiencies and increase charges flowing through. The other thing that I would point out, though, and it's somewhat tied to the burnout, and I'm talking to more and more clients about this, and that's a protection of those most trusted, those most venerable in systems that we stretch too far and too many times. And what happens is, and I think we all would do it, and it's very, very natural, we stretch and we see if somebody can cover more and more and more. And what happens is we do that in succession, and then we turn someone who's looking for another permanent role out in that competitive environment. So that can really hit on a financial basis as well. So I would add that to the mix.
And Erica, I would also even add that a couple of things. When you're putting, Ben just hit it pretty close to home, like when you're putting a person in a position to manage productivity or throughput that has that experience in really getting those financials fine-tuned, come back to my previous comment when we're doing an intake for a client, really understanding if they've got that for-profit experience, as Sheri mentioned, or the nonprofit experience, because understanding that landscape is very different based on those roles, right? And so I think when we're talking about getting back to black from a revenue standpoint, getting interim leaders that understand that, they can, as Sam said, really take that by the learning curve, I think, take the learning curve out of it. And there's an insurmountable value in bringing that forward very, very quickly. Plus, I would almost challenge any recruiter that's out there there is a cost to recruiting, whether it be a physician, a C-suite executive, or a manager. There is that cost associated with recruiting. So if you can bring someone in, bring them in quickly, and really have them manage that effectively, it should bring your overall cost of recruitment down instead of up.
Yeah, I may just add one more thing here, and what a great topic, right? And so crucial and important to every executive right now that is living through the time of managing to cost, managing to margin. Maybe hitting on the point Preston, Ben, Sam, and Sheri have made, right, is setting the rigor and understanding the structure of what is the project, what are we after. It doesn't matter what the specialty is. But recently sitting with one of our partners, right, such a compliment to hear that individual call out, I know a B.E. Smith interim any time of the day, right? Because once we've set those objectives, we've got a great team, right, that supports, and they're reporting out on what they're doing, right? So I think a differentiator is not only to be able to call out what we're doing at the beginning of that process, but, coming from that individual then after, a differentiator of being able to report to how the outcomes are going through the project. When you're looking for an ROI, it doesn't matter how you're quantifying that. There's going to be a difference maker in how you manage through the process and report to the outcomes at the end of the project.
Yeah, I think all your points really hone in on just the invaluable role that they can play with staying on track with strategic initiatives, and to what several of you mentioned, like we can't afford not to have this role filled for X amount of time. Let's spend some time talking about interim versus traditional consulting. Some organizations do turn to consulting firms for support. How does an interim executive differ from a consultant when it comes to implementing real change? Sam, would love to hear from you on this one.
Well, thank you. And I've had the good fortune in the course of my career of being on both sides of that decision, either as a permanent chief level executive and then now as interim. From my perspective, interim leaders really come in with it, as River defines so beautifully, a specific set of outcomes and objectives. But they're taking the role of the leader. The way I described it is that the interim leaders actually get off the dock and in the boat with you. They are leaders. They are leading teams. They are a part of your executive team. They are standing in the organization as a leader. And that's a little different than a consultant who continues to maintain that external expert role, and that is important in some areas. But if what we're trying to do is have an expander, a leader that can come in and not only bring those best practices, but also roll up their sleeves and implement it, and holding space in that leadership team and being a key member of driving a positive culture, both for today and for tomorrow. I think those are some key ideas to consider. I also want to recognize that interim leaders are they're ready to go and are well practiced and experienced in getting in and helping to address the problems quickly. There's not a prolonged assessment process. This person is a member of the team. They're focusing on stabilizing and maintaining what's working in the business, and then helping to define and build and strengthen cultures. So understanding what's working and then continuing to build on and not being a burden to the other executives and the organization, but actually being a member of the team. And then last but not least, I think having that fresh set of eyes. So the benefit of an interim executive is you're getting someone who's seen how it's done in other places. And that can be an invaluable set of experiences as we are all in health systems seeking to understand what transformation is necessary in order to not only remain competitive, but embracing what's available in the future as we're all facing challenges with our workforce, talent cliffs, and growing patient populations, as well as ever-changing revenue and regulatory models.
Sam, I love the analogy, getting off the dock and into the boat. I mean, there is something very valuable about a leader jumping in and picking up an oar, right, ready to paddle with the team. Shameless plug for AMN and our project Heal, where we offer consulting services. Certainly, we have the ability to do both. But our interim leaders, everyone that I've been able to place at clients that I've been out and sat in front of, they love to know that it brings in a little bit of that stability to the boat. Interestingly enough, I think that the word consultant sometimes has almost a fearful term to it in an organization, right? It can bring a little bit of fear based, oh my gosh, we're bringing in a consultant, and that's a little bit nerve wracking. But to your point, when you have a leader that jumps off the dock and into the boat, picks up an oar and says, let's go to work, I think that it maintains a very positive culture all around. It says that the organization's bought into everyone's success, and certainly each have their respective place, and where you've been on both sides of the coin, it's wonderful perspective.
Yeah, thank you both. Thank you.
And I almost feel that, when you have an interim leader, I'm sorry, so one other thing, I'll just jump in. I almost feel like sometimes when you have an interim leader that you almost get 2 for 1, because they have so many varied experiences. Many cases, they can bring those experiences to the situation almost like a consultant would as well. So I think they almost get a 2 for here a little bit and get the consultant a little bit sometimes baked into an interim leader as well.
Yeah, thanks, Sheri. Great points. Well, let's spend a minute here just chatting about choosing the right partner for healthcare leaders who are looking to engage an interim executive. What should they look for in an agency or in an interim leader to ensure that they are a right fit?
I'll jump in. We've utilized a number of different providers, and during this time period, and since I've been in this organization, and having a trusted partner is absolutely critical. It's essential to work with a firm you can confidently say, here's what I need, and then really to trust in them to deliver quickly and effectively in that situations. B. Smith has been an example of that. And then when looking at these situations, you usually are looking at from the lens of, is this a chaos to calm situation? It is about transformational change. What are you looking for in the situation in general when you're thinking about the organization that you want to work with as well, and what they've been able to give to you as far as candidates. In addition, each scenario really requires a different kind of leader and a tailored strategy. So again, you're thinking about this in terms of the organization you might be working with and partnering with, but really be thinking about, beginning with that clarity in mind about what is the true goal of what you have in mind for this particular partnership. But really, again, utilizing A&B Smith in the past, they've been great to partner with and really have given us the space to kind of think through what do we need for a particular position, but then also, thinking and asking us really good questions about what are the type of leader you're going to need for your type of culture. And then as the leadership, the interim leader progresses through their assignment, really kind of sticking with you and asking you, how are things going, coaching that particular leader, and being with you all along the path is important just as much as it is identifying the candidate to begin with.
Great point, yeah. Sheri. I think I would just say, and Ben, I didn't mean to interrupt you. I know you had a thought there, but I think that I've been sitting in front of clients who ask this question: why you, Preston? Why AMN BE Smith? Why, what is it about you that sets you apart? And I can say you hit a couple of key words there: partner, strategic. AMN and BE Smith are not just an out of the box, off the shelf sort of solution. Every client is in a very different situation. Every position different than the next. So I can say that we treat all of our partners as such. We take great value when we are selected, to be able to make sure that we have a tailored solution to that client, to that, not just even the client, but the position itself. So it's more about really driving the conversation, and it's the continued care, if you will. We're all in the care business. It's the continued care beyond the placement. It's not just great, here's your leader, good luck. It's the continuous check-in. And I would challenge that we have some of the very best on our back end that take care of our interim leaders, that are connecting with their clients, asking how things are going with that leader, getting constant feedback, trying to make sure that we're executing at the highest level. And so I would say that really is, finding that quote unquote trusted partner. It gets thrown around a lot. We want to be your trusted partner. I think it's where the rubber meets the road, is how is that executed at the highest level? So just from my chair, I can tell you that our team has done a really great job on that, and trying to make sure that we follow it from beginning to the end of the assignment.
B. Smith and AMN, such a dichotomy. The industry, in a lot of ways, industry maker in terms of B. Smith's history with it, could rest on laurels, could lean on traditionalism, but never has. As much experience as we have, we're always leaning towards innovation, always leaning towards new approaches to meet our clients' needs. As Preston and River pointed out, service offerings have changed. In the 9 years I've been here, service offerings have changed dramatically to fit the evolving market. And I just think that's what our clients appreciate, and not just our clients, our candidates. So our interim leaders look to us to really make things be smooth, make things go well, and we take great pride in doing that. And our clients expect the same. We present, we're able to have resumes for our clients to look at within 2 or 3 days. We have interims on assignment, usually within 30. A lot of that is dependent upon orientation dates and so forth. But it's such a blend of those things that really make B.E. Smith and AMN the right fit for clients and candidates.
Thank you all. It really sounds like personalization is a big component at play here, and being able to see that in the process of choosing a partner. Well, the appeal of interim leadership, let's talk about that for a moment, since many seasoned executives are choosing interim leadership roles instead of retirement. What is motivating leaders to take on interim roles, and what advice might you give to someone who is considering this path?
Well, I'd be happy to jump in since I'm a retirement fail. I have a couple of colleagues that gave me a retirement fail t-shirt, literally. I believe that interim leadership is ideal because it gives you an opportunity to leverage what is a multi-decade career and point it towards new and exciting projects and opportunities in other health systems. I'm an avid backpacker, so this helps to support a more flexible lifestyle, in that I can take assignments and then work extended backpacking trips around that. But that level of flexibility is important also in a sense of regeneration and refueling, so that the next assignment that I take, I'm coming not just with a full bucket, but enriched with experience from the last assignment as well as a career. So it couldn't be a more dynamic time to be in healthcare. And as someone who's been an executive leader during COVID and other things, I know I've had that statement a few times in my career, but we really are at a crossroads right now as we're seeing the rapid pace of utilizing technology, our workforce challenges and opportunities, as well as just the transformation of our business model in healthcare is setting the stage for a very dynamic 5 years, I believe. And the use of interim executives, as we've been discussing for this hour, is a way for health systems to bring in and leverage expertise, and then not have to carry them on an executive load moving forward, but bringing them in, again, thinking about that just-in-time capacity builder that enables and expedites transformation in your health system.
Maybe to follow a little bit and to Sam's point, even Sheri's point earlier, right? It's hospital week. I've spent my time in healthcare. So to me, first off, I haven't met a lot of healthcare leaders, healthcare clinicians that aren't driven by purpose and passion. And so I'd maybe start there. I think, again, one of the biggest compliments we see is executives at a level in which they're getting ready to make a transformation. And maybe that first conversation as we're ending that is, well, what would it be like to be an interim, right? What would that mean? And so, I think one of the things we're seeing right now as to choosing to why, to Sam's point, right, is not only that passion and purpose and lifestyle of how to be a part of that, how to engage, but giving back, right? If we start at the beginning of this, of, how are we shaping the future of care? What does that mean? How are we building healthcare leaders? I think some of our most brilliant interims we are seeing today, doesn't matter where, have an immense amount of knowledge in which we need that knowledge, right? And so as we do see retirements, as we do see transformation, the opportunities to come in and be laser focused, right? If we continue to take themes of this conversation, be exact and teach our younger generation. We have this generational gap, right, going on in leadership in healthcare right now. And so being able to get back to that, I think a lot of our seasoned executives are really excited and passionate about being able to instill and depart that knowledge. And that's one thing we see as well. And maybe just to build on one other side, because it's not just seasoned executives. I think one thing we're starting to see in a generational workforce transition, if we want to call it the gig economy, or, as we look at some of the changes, is we see younger leaders, right, making lifestyle choices earlier in career. So I think one thing we will also see as we look to those directors and managers and clinicians is individuals that may choose lifestyle. We see this both on the interim side as well on the locum side, is being able to travel and to fill that bucket in different ways while gaining experience and growing in their careers. And those are two really major themes that we are currently seeing today.
Yeah, certainly. Well, thank you all so much. So many terrific insights shared here. So very highly relevant, timely conversation with the trends we're seeing in the workforce as well. I want to shift now to the Q&A portion here. We've got about 7 minutes left, so we'll get to as many as we can. And as I mentioned, any that weren't answered, we'll do our best to get back to you as well. So let's see what we've got here. So first question is, as we rebuild succession planning, what is your biggest tip for gaining support from executives who are afraid of succession planning?
I can jump in here as having some firsthand experience with this. We actually started not at the C-suite level first. So maybe looking at director level, system director level type roles first, and folks getting some exposure to that. Once they saw the benefit of what a person can come in and how quickly they can ramp up and have some proven skill sets, you were much more likely to consider the CIO role. So something to think about from that perspective, from my experience in getting folks acclimated maybe to an interim type leadership role.
Sam, I feel like you had a really good, and I don't mean to put you on the spot, but I feel like you had a good answer to this question too. I think it's part of the, maybe the board's charge for the C-level is to have succession planning, if I'm not mistaken. Can you share just a little bit about that?
It is. I have had the good fortune of both obviously supporting boards as in a C-level role, and also now on boards for health system. And it is one of the board responsibilities to ensure succession readiness and business continuity for all the key roles in the organization. An interim executive can be a solution to succession. So certainly in those circumstances where there is a near-term need and a need to ensure business continuity. And that's a wonderful opportunity for governance responsibilities, and including, I'm on a health services board, and we actually just listed B.E. Smith as one of our go-to organizations in the event of near-term unmet executive needs. So very, very true. Thank you.
Thank you, Sam. Thanks, Preston. Next one is on the candidate side. Is there a preference for reframing a CV for interim versus permanent leadership roles?
Our team, we have a team, Erica, that works with all of our candidates when they raise their hand or when we reach out. So a standard part of our process is doing just that, taking a look at what they're currently using as a resume. In most cases, it's not a very different path in terms of the standard stuff is the standard stuff, and that is everyone's looking for achievements in terms of SMART definitions and so forth. I would say that what they're looking for once they start being an interim is our clients look for all those interim engagements that are on their resume that are ongoing in terms of the efficacy. What did you do at this assignment or not, or that assignment? There's often an idea for the first time interims or interims that are new to this, that short stints is a detriment. Once folks are in the interim world, it's not so much the duration as much as what was done or what was the starting line and the finish line for you. So I think that's really what's the differentiation. But most of the time, there's not a whole lot of tweaking in terms of going backwards in time. It's just those differences as interim assignments come into play.
Yeah, makes sense. The next question is around having an interim manager coming in, and what are some good first steps to bring them up to speed on our needs?
Maybe I can jump in.
Go ahead, Sam.
Yeah, as a person who's been an executive interim, I think obviously, and the B.E. Smith AMN team will help with this, but the key priorities for outcomes and what those outcomes, like short-term, near-term, end of project priorities, are really important to get clear on. But also helping to orient the leader on what successful leader behaviors look like in the culture, and ensuring that they are, because every culture is different. And so just making sure that this person is set up for success in your culture. And there is the leadership with their directs, so the people that they're going to be managing, but don't forget about their peer leaders as well, and making sure that they have opportunity to build relationships and be integrated at their peer level as well as their direct reports.
As we screen and interview interim leaders, the culture part is right up front, and that is it's table stakes that you pick the role. We know you need the basics, and it's expected. The key element of success is that ability to flex per culture. It's not about our interim leaders' way of doing things or how they like. It's fitting that into the culture. The other thing that I'm always very attuned to, especially with our orientation of new interim leaders, is to always calibrate. And Sam pointed out, we have tried and true leaders, but they always want to calibrate to not just what's expected, because that list of 5 or 6 or 8 or 10, it's going to be there from job to job. What's key for success is making sure they're all lined up for this engagement. And a lot of times, if that's not done right up front, the engagement doesn't go as smoothly or as fast as it could. So we always really ask them, don't assume anything on those key priorities. Even if you've done this for 20 years at 6 different hospitals, make sure you've lined up things and confirmed it with your direct report.
Well, Ben, you brought us right up to the hour there, perfectly on the mark and timing. That is all the time we have for today's discussion. Sheri, Sam, Ben, Preston, thank you all so much for such a call today. Also want to thank B.E. Smith for sponsoring today's webinar, and thank you all who joined us. We hope we have a wonderful rest of the day. Keep an eye out for the recording.
Thank you, Erica. Thank you, everyone.
Thank you.
Thanks.